There it is. All right, Henry.
Hello,
Welcome to
doctor.
Crooked Spine Show. I've met you. When did we first meet?
Oh, I'd say probably about 5 years ago.
Yeah, about 5 at the club, right?
I actually met you through a friend, Tim, who told me to call you. Or
That's what it
had
was.
you call me.
And you came by, but I saw you. Did I see you in other places too?
No,
or
no.
Okay. That's when you're working in an Upland place, and then you moved over here.
Yes.
You've been here for about 1.5 years now. Followed your Instagram story, kind of went through some of your information there too. I was kind of stalking you. Did my best as I could. What made you come over here? How's this worked out for 1.5 years? What have you kind of transformed your training into?
Well, it's a gradual progression.
Okay.
I started off in martial arts.
Yes.
As a young man, as 10 years old, but it's been part of my life since I was born, and I followed that path up until I was competitively about 20, 21.
Okay.
And then I went in to study music. In that time frame, I also became a massage therapist when I was 20.
So other arts.
Just artist, basically, overall, just arts.
Nice.
And when I then started to apply all of my arts together, I realized that they're all related.
Isn't it amazing how they work?
Yes, totally.
Wow.
What I got from when I studied opera, I got a lot of alignment of facial relaxation, neck relaxation, breathing techniques. In my martial art, alignment, focus, connectivity to oneself, but that's also connected to music as well, and also breathing. They all coincide.
So what the correlation, does it get your body to relax by doing that?
So it's a good question, because a lot of times people will say to me, because one of the main questions I ask is, do you meditate?
Okay.
And 95% will say no.
It's Southern California, man. This is doggy. We don't have time to meditate.
And I ask why.
Yeah.
I ask, why don't you meditate?
Yeah.
And they say, I don't know how. I've tried that. And then my next question is, why do you expect to be good at something that you've never tried?
The right way.
The right way. Or you just start. Because as a child, as a baby, I'm watching my 1-year-old daughter.
Yes.
And I learned from her too, because she's one of my biggest teachers. Is she persistence, and not caring about judgment. No, she doesn't care. She's just gonna do it and do it and do it.
Yeah.
So in that pursuit, I've seen a lot of people also too understanding that they're always in control. It's a choice to be rigid or to be limp. In martial arts, you have to have both to be fluidity.
Okay.
So if I'm loose and then I hit, but at the same time I become loose again, I can't be rigid the whole time. I mean, that is a practice.
Yeah.
But it is also to be controlled.
Oh, okay.
So helping them understand those concepts to apply to themselves.
Okay, so let's get back into it, part 2.
Okay.
From the break.
Yes, sir.
I like how you correlate being a dad, because my daughter's 15, I have kids too. How we relearn, that's how now as a dad I see my kid doing this with me.
Yeah.
I'm seeing the other side of being a kid now, going
Right.
and trust me, my daughter's 15, you're going to go through a lot more of those O's on the line. It's going to be crazy.
Know.
It'll be exciting. How's that? Exciting.
Yeah, exactly.
But a lot of it is, as you're talking, I'm thinking about how much they can wear you down to get something.
Mm-hmm.
You know, they don't want to take a nap. You're like, just take a nap.
Mm-hmm.
I want to take a nap with you so I can get my nap in.
Yeah.
But you're killing me over here.
Yeah.
You know, how do they have so much energy? I was talking to one parent today. She brought their 2 kids in, or the 2 parents brought 1 kid in. Like, this kid just has some energy because it's healthy.
Okay.
They're healthy that way.
Oh yeah.
And they don't know how to control it sometimes too, which is fine.
Right.
But the able to relax and smoothly move and go back to contraction to go over what that means again.
So understanding that rigidity and fluidity, or limpness, looseness, is part of control. It's all choices. When we allow ourselves to be controlled by our thoughts, by our fears, by our insecurities, by our stresses of life, quote unquote stresses of life, and negative stresses more so, because I don't like to consider stress as a negative. It's positive and negative.
It can be exciting, it can be excitement.
Exactly. Weight training is stress on our bodies, but it's positive at the same time. All those, when we allow negative stress to control our lives, we then lock up. Oftentimes, our American culture said, "Oh, I'm too old for that.
Yeah.
I'm too old for this. I'm too old for playing. You see that all the time. You hear it all the time. And
in
then
the news, media, people, everything. I'm like, what are you talking about?
And then you see it. You see them become what they say they are. And you're right. You have now become too old. But you can change that with effort, and it takes work. And when I tell people, I'm going to help you, but you have to do the work on the same time, we can only take you so far.
Are you a psychologist?
No.
Oh, good. Neither am I.
Yeah.
And by giving them direction and guidance, this is the work I want to do. By being compliant and doing the work, the patient, the client allows them to see the difference.
Mm-hmm.
I like you talked about movement and stress, because what I talked about with my talks in my office and also outside the office too with my patients is when you're stressed, your body will naturally produce chemistry to where cortisol hormones get your body to actually shut down and tighten up.
Mm-hmm.
You have to fight that once you realize that what's going on. So you move to de-stress your body, relax your body, loosen up, and by working out, having good stress, that allows you to do that.
Yeah, and a big thing too, what I'll tell people is, I ask them first.
Sure,
I don't want to tell them anything. I suggest. I usually just say, I'll suggest this. If you do it, great. If you don't, that's fine.
Yeah.
But I ask them, have you ever tried yoga? If they say yes, if their response is, I don't like it because it's an exercise that I'm not getting, I stop them right there and say, yoga's not exercise.
No.
Yoga's medicine in India. It's been medicine. It's medicine that all animals do in the morning. They wake up and they're like,
stretch.
Every morning, if you're not doing those kind of things, but we just gave it a name called yoga. We gave it a name. Yeah. Whatever.
The U.S. version of stretching.
Another one is, I ask men, mostly men.
Oh gosh.
Do you dance? Men predominantly say no, but there's a movie out there called Men Who Stare at Goats with George Clooney, a couple of other actors, big names. And there's a part where the gentleman is saying, okay, I need you guys all to dance. He's military men to dance.
Right.
And one guy, George Clooney, is no. And he says, I don't really dance, sir. And the guy says, no, you were just told that you shouldn't dance. And then he has regressive thought of something that might have stuck in fear. And then he starts to open up.
He's able to loosen up from one too.
Right, but I have a memory of dancing when I was 6 years old. Oh. My family's dancing Latino music. They're doing cumbia dancing, and I'm looking at the steps. And I just start to try.
Picking it up.
Just try and try. And then I started just, like, you see other things, and you just try.
Yeah.
And experimentation. So I tell men, go in the bathroom, no one's there.
Yeah.
Use the mirror, put on some music, and dance and laugh at yourself. Yeah. That will help you de-stress and become better.
We'll bring the pride factor and things I don't want to be embarrassed type of thing out of the realm. That's why I do these videos, so we can embarrass ourselves, right?
Yeah, this is fun.
It's fun.
I'm having so much fun right now.
Well, and a lot of it is the movement, and you talked about earlier too about the idea of getting and being old. It all starts up here. Mm-hmm. What are you going to listen to that is important to someone else, but not to you? Mm-hmm. I have a patient. He's probably in his mid-60s. Looks like he's probably low 50s years old. And one thing I'd ask him, what's your secret, man? Because he had a little back pain in my office, plays golf probably 4 times a week, still works part-time as a consultant. And he goes, I never use the word OLD. I never use the word old. Mm-hmm. I always think everything in moderation. I'm going to try everything I can. At that point, keep moving. I
like that.
Never use the OLD word.
That's heavy, man.
Because it makes you into that category of now I have to stiffen up. Now I have to be a grade. Now I have to take more Metamucil every day. I just made a rhyme there. I don't know how I did that. But a lot of it is, how do we get ourselves to think, hey, look, I'm not 20 years old. I know that. I'm going to stretch more, I'm going to do more things to stay active, but can I do more things so I don't feel old?
Mm-hmm.
Can I move more? Can I wake up earlier? Can I not eat at Denny's at 6 in the morning every day like sometimes people do, because that's their routine.
Mm-hmm.
Stay out of that routine.
Right.
Stay out of the sheeple, the average person who's 65 who's taking 7 medications,
Mm-hmm.
and all they're doing is looking for the next medication.
Right.
Because that will make you feel old. Going into the doctor's office for medications, you will get 10 years older, period. That's guaranteed. But can you reduce those? Can you go to your doctor and go, how do I take less medication?
Mm-hmm.
You're going to go, well, why? This is what we do. You have to find a different way. That's why you have what you have to help people realize that, I think.
True. I 100% agree with you.
Okay.
100%. 110% agree
Good.
with you. 110%.
Fantastic.
Language, it's interesting how you say one thing and how I say the same thing, just using different words.
Exactly.
When you talk about medication, I associated that with modification. So when you exercise and you can't do an exercise, they'll call it, well, we're going to do the modified version.
Yes.
The modification, the compromise version, just to meet you in the middle so that you can eventually get to doing the awesome, cool stuff.
Yeah.
Right? Well, medication, it's there. Yeah, you need it to, to make your blood, coagulate so you don't bleed out.
Exactly.
There's certain things that are there for you.
Surgeries, accidents, trauma.
Right, exactly. There for you and for it to be in the moment.
Yes.
But to live off of it is impossible.
It doesn't replace your body's natural way of healing. And I think some people may not know this, is where you can still die with medication in your body.
Mm-hmm.
It doesn't give you the oxygen, the nutrients, the vitamins your body needs to get healthy. It just it'll mask and cover up the problem so you feel better.
Mm-hmm.
Your blood pressure numbers will come back better.
Mm-hmm.
Your blood levels will come back better, but it won't fix the problem, especially long term. So what can you do on your own by working with a trainer, working with a chiropractor, working with a personal trainer or an instructor or nutritionist to get yourself healthier outside your health insurance?
Mm-hmm.
Health insurance is there not as health care. Come on, people. We know this. Come on, we know this, right?
Yeah,
right?
just like auto
it's
insurance.
sick care. And you use it when you have a trauma.
Right.
When you have a fever that's 102 for 4 days.
Mm-hmm.
When you're dehydrated. When I fall off my mountain bike and I may have hurt or broken something again.
Yeah.
Okay. But when we want health care, where we go once we're not sick to get to our healthier states, can maintain and tolerate more stress and avoid injury, or if you have an injury, get better very quickly.
Yeah. So
That's my soapbox.
That is it's a good statement and question too. How can we? One thing that I suggest, because I'm a massage therapist, so when I work
You're more than that though, so don't put yourself in that one category.
As a massage therapist, not I am, but as a massage therapist, when I work on the soft tissue of the body and softly manipulate the body, I find that so much of it is in the first portion of it is just the person getting trust. The person getting trust in a new environment, the person being able to connect to just learning how to relax. To learn how to relax in all things. When you get a new job, you can't flow in your job because you're so nervous that you're going to mess up. But if you go into a job confident that you're going to mess up, guess what? You're not going to have any stress.
The expectation is a lot lower.
Right. Exactly. Expectations to perform, it's funny how clients will come in and have a nervousness to do good, and all they have to do is just lay down.
It's too simple. It's childlike.
It's so funny.
It's childlike, which is a good thing.
Yes.
And I think a lot of people, and I sometimes, myself included, as a boss, sometimes expect perfection from everybody.
Mm-hmm.
When we can learn that by messing up, we learn better.
Oh yeah.
Then we understand, and now I have it versus before I did not.
Right.
Some comes in and I give them a bunch of exercises to do on the weekend, whatever it is, or ice down because their back is sore and they forget. I go, great, now we have a good starting point.
Mm-hmm.
Now we know what you didn't do, let's change it this week.
Yeah.
You don't scold people. I mean, they're adults. Come on, they can,
of course.
whatever.
Exactly.
But how do you get them to realize that one thing now has made the habit stronger.
Right.
By them not wanting to, now they feel more pain, they go, what I didn't do. Great, now we lock it in.
Yeah.
It's key.
Habit. I do martial arts at the school in Upland Claremont called the Kali Method. I've been going there for about 8 years, and I actually have a shirt on right now, repping my
Good
school.
sponsorship.
Good. It's changed my life. My teacher changed my life.
You did that martial arts beforehand too, correct? You're from originally.
I grew up in Pomona.
Okay.
Grew up in Pomona.
So you're more of a local kid, anyways.
Yes.
Okay.
Yeah, and if it wasn't for this school, I would have already left this area. But because this school has been a pinnacle portion of my just failing, learning, growing, persisting, it's affected my work, and it allows people just to have patience. Like one of my videos, a lady is walking, her gait was not proper. We did some corrections with her. I think it was a foot thing or something like that. And then her just walking in balance and being aware of her walk, it then affected her emotional state, because then she mentioned something about, well, she's in her 60s, so she then makes a statement about, well, I'm walking like I'm sexy. I'm like, well, you should feel sexy.
Yeah.
It's not a bad thing to feel attractive. Of
course.
And that gives confidence, and then that gives an incentive to do more of that to then feel good. And
it's amazing.
It's like, okay, but I'm not the keeper of that. I'm not the creator of that. I'm just kind of riding the wave. It's like, well, we'll see I honestly, there are things that I do that I know have helped me, and I know that I've been proven through martial art hundreds of years. Was it, well, I know that's beneficial, because if I can't do that little thing, I can't do a very good kick. Well, if I can't do a very good kick, I don't have very good balance. Well, let's just apply that at a smaller level to just walk. And then from there, well, how do I then I go back, then I go to the manipulation massage therapy side, and then, well, we need to open those things up so that it'll help her to open up that ability to move or to elongate, and then fire off the muscles that need to fire off, and then we can progressively dance in this push, pull, back and forth type of
a normal rhythm.
Right.
And I think a lot of it is we're talking about too earlier, is when the body can relax and find the one or two things you can narrow it down, go down the rabbit hole of, okay, if it's not this, it's this. If it's not this, it's this.
Right.
If the overall goal is to walk better, sleep better, relax better, work out better, if that's someone's goal, to prevent injury, even just driving a car without pain, that point, what can we niddle it down to? What is the one or two areas that might be an issue, by watching someone's gait, by watching what they're doing, by watching how they exercise, how they move, what their form and technique is, that gives you as a therapist, okay, what do I have to work on? What is going on here in that muscle group, in that shoulder, that lower back, that foot, that I can work on or give them pointers on to get looser, become more flexible, more motion, so it releases those toxins in the body, get your body to overall relax.
Right. And the state of relax is always, because there's also necessity for the rigid too, and the focus and control. Like if I want to do a heavy lift, and when I work with my people that are, do workouts, or power lifters or CrossFitters or whatever, and I myself have worked out with coaches that do that.
Yeah.
And found some of the best in this area to refer people out to. And sometimes I'll even tell people, you should fire your trainer, because that trainer is not doing you justice. Sometimes people will look at price of exercise, like I know that group exercise is very popular right now, and it's a little cheaper to do group sessions other than personal sessions. But I ask people, when you first start something and you're having a problem with something, you would eventually seek out a tutor. And that tutor is usually a personal trainer. Of course, you want them to be credible, all those things. I usually will suggest certain people, but I'll look at them and like, you know what, if you can't work out just your squat without weight, because I don't have weights here, I can look at that and be like, yeah, whoever you're working out with is doing you an injustice.
Yeah.
And even that, as an advisor, as a middleman to helping people, that's help too. To tell them, hey, you know what, that person not helping you out. Actually, you're gonna hit a roadblock that's gonna eventually break, and then you'll fit your fitness level or wellness level that you're trying to achieve is gonna be stunted, and then your frustration, and then it's like, what now?
So knowing that foundation of where you should be, even without weight, for example, a squat or a deadlift, at that point, if you start adding more weight, it only can cause injury.
Oh, for sure, 100% every single time.
And most guys, especially, we want to see more plates on the bar. We want to see more things going. And I'm okay with that as long as you don't have something going on inside where it can give out.
Right.
All of a sudden you're down. How many times does it happen to people?
Oh, all the time. If when I was a trainer, I used to do personal training, and my style was we don't load it until we can do it.
Yeah.
If we can't do it,
you have to be patient.
We can't load it.
You have to be patient, and sometimes you have to break down because they've worked out in the gym since they're probably in high school. And what did the high school coaches tell them in high school to do? Did they work on their technique?
No.
It's about a numbers game. What do you lift this week? What's your number?
Yeah.
What was your squat this week?
That's true. It's a good point.
What was your deadlift this week? And that's the problem is these kids, they probably won't get hurt. If they do, it's pretty bad. But when they do, that carries on to their past high school life, to their sports they're going to play. So what I deal with is how do we get people to lift properly? Again, good technique, a foundation, and go from there. Because spend the time. It may take 2, 3 weeks or 4 weeks to realize my technique is off. I have to go from my bad technique, that bad habit, and then go from 0, then go good technique. It has to swing the pendulum all the way over.
I had a trainer come in this weekend, and big heavy dude, strong guy. And he's like, I'm getting some knee pain. I'm like, well, when do you have the knee pain? And when I squat. Okay, well, I do a muscle test on his glute, and the glute fails. I'm like, how often do you check in with your body? And that, well, depending on, if I'm only doing weightlifting, that's fine. But if I never apply things that are that really utilize my hip, like if I'm sitting in a chair and I push my butt and my heel presses to the floor, I know my butt's awake.
Yeah.
But if you can't do that, am I gonna squat? No.
How do you isolate each muscle to know they're working properly?
Dance.
Oh, okay.
Dance comes into play. So if I can shift my weight here and pull that here, I know that can be a move, but that can also be a punch. If I have technique in application of my body without weights, if I know what I need to apply to have a really good jab and a nice cover or a very good kick without throwing out without my hips going backwards and my balanced leg is pushing, but that can also be yoga too. If I want to do tree pose.
So balance is part of the controlled motion.
Absolutely.
When you're moving.
Totally.
Wow.
Totally.
Okay.
So the curiosity, and I think curiosity is super important because when people say, why? Well, why not?
Yeah.
Why not? Just try it out. Give it a shot. Just try it out.
It's not going to kill you, people.
No. It's better to be a participator than a spectator.
And better to try and fail than never try at all.
Amen.
You may have learned something that day.
Totally.
Totally. I like doing something different myself, especially when it hurts or doesn't feel good or it feels awkward. Like, great, I can work on.
Yes.
I found my weakness.
Right.
I found something I don't know what to do.
But think about how many people, when they feel something, I shouldn't. Yeah. And then, and this is no offense to the medical system, but oftentimes the medical doctor will tell you, well, then don't do it. Just don't do it. And then how many stories have you heard where the person didn't listen to the doctor and they're doing miraculous things?
It's spontaneous. It should never happen. It's ridiculous. But, I mean, and what I get to in my office is a lot of, which you probably see too, an injury. Someone has an injury, go to the medical doctor and they go, well, stop doing that, take some time off, hold off that completely. So they stop doing anything. And when you do that, especially for an inflammation or there's something that's an injury, at that point things lock up even more. Your body becomes weaker, more atrophied. To get back on it, it causes pain, so you avoid it again and again and again. Now you change your whole biomechanics to avoid getting out of the chair.
Yeah. My dad is former military. He's 33 years military, and his saying has always been, "Embrace the suck, embrace it." It's been of course there is a portion of you where you should not push it.
But how many people even get there?
To embrace it.
I mean, some people get there where they should avoid it so they don't cause injury.
Mm-hmm.
People don't even get close to that point.
Right.
They avoid that completely.
Of course.
Yeah.
They're afraid. That big fear factor. Anxiety, all those things.
False fear.
So, and what I'm seeing across the board in this industry now, of course, I'm great that you're even doing this interview today, man. It's really cool.
Right, fun.
Awesome, fun.
Entertaining too, hopefully.
I hope so. Yay.
That's the plan.
But also with the people that I'm seeing on social media, a lot of it is just empowerment. You're hearing so much about just empower other people because in the first portion of this video, of this interview, I talked about just helping them help themselves.
Open their eyes of what normal should be, what normal motion should be, what normal thought process to get the motion should be.
Right.
Like, what can I do differently? Not, I better stop everything because it hurts too much.
And then it transcends into other portions of life because there's no limit to life. There's no limitations to what we can do. When I apply my singing to my therapy, and I say, well, our heads and our alignment, our position of head, is very correlated with our ability to open our mouth and speak. And how many stone faces do you see in the street? Say hello, hi, and they're frozen face because they're not expressive.
Yeah.
They're living inside a little bit of
kind of closed off.
Now it's
I don't
harder.
see that very often, but yeah, that could happen.
It can happen.
Yeah.
They're
so closed off. You
Right.
kind of feel sorry for them because they're at a spot mentally they don't want to enjoy life and enjoy the people around them.
And just like, and the curiosity of just being like, hey, hi.
Yeah,
And my
what's
daughter.
going on?
My daughter.
Oh, kids are phenomenal.
Hi. Hey.
Kids are so open-minded and just are looking at anything. And they may get hurt and they'll cry for 2 minutes and they'll be fine.
Right.
They don't remember that. They don't keep in their head, I better avoid everything because
No.
that one thing hurt.
Right. And so we all are children in this big place.
That's it.
We're just kids
For a very short period of time.
Exactly. So I look at kids like, man, they're the greatest teachers.
It's phenomenal.
Of how to
we
have
have
fun.
1-year-old. Wait till they get even more exciting.
How to have fun
Yeah.
and how to be lively and how to be loose and not, and then somewhere down the line conscientiousness kicks in, and then we start to regress, and then we have to remind them, hey, when you were this age, that wasn't even an issue.
Well, and I've done interviews with child psychologists, with yoga instructors, and my last one was even a teacher who teaches music out at Pomona Catholic, Pomona. And a lot of it is when we get to a certain state, maybe junior high or even high school, we lose that confidence and self-esteem.
Oh man,
It goes.
It goes.
It could be several thousand reasons why you get that.
Right.
But when you do that, your whole ability to stay open to ideas becomes very, very small. And you've limited your ability to learn, enjoy other people around. That's why you see the wallflowers that don't want to do or say anything. And you see their grades drop. And that's not the number one thing you worry about, but why?
Right.
And how do you get them to open up? Through music, through dance, through the arts. At that point, even through exercise too, so their body produces more serotonin, more endorphins, so for a moment the body can actually relax.
Yeah.
Your body wants the motion, the learning, the thinking, the even, like I said, I didn't realize even with music too, through Music Tree over there in Pomona, a lot of it is that gets that confidence up again where they can maintain that through high school, even through college and even the rest of their life.
And our culture, our society, used to be very musical. All human interaction and cultures have music, have dance, have art.
Yeah.
It's a part of human necessity. necessity. Healthy.
Yeah.
When we would congregate as people, congregations in church, there's music. Sing along, everyone. Be free. Wee.
Yeah.
All that helps. And then you get out and you're like, wow, I feel so good. I'm so glad I went there. What did you do for that hour? You participated, hopefully, in some sort of song and release. And then why do people want to go dance? I tell people, if you want to dance, dance right there.
Right, done.
Don't go anywhere. If you have to, just dance right there. That'll help you. And then if you want to go somewhere with more people, fine, that's also good too.
Yeah,
no
don't
problem.
embarrass yourself. Make sure you're in the same dance.
Yeah.
Abilities.
I mean, yeah.
Abilities,
I have
abilities.
some friends.
Me zero.
I have some friends that aren't very good, but I always congratulate them for being enthusiastic about it.
A for effort.
Exactly.
A for effort.
Exactly. And
But the body needs the motion to stay healthy.
Mhm.
I did an interview with Christy I think 2 weeks ago. Same thing. You get up and you move. You move. You move. You move. Your body just feels better.
Right now I'm working with a contortionist who's teaching me different ways of stretching, because what I've seen in the predominantly physical therapy, regular therapy type of stretching is that it's limited to only walking.
Okay.
It's limited to only walking and only grabbing some things, because we only want to do the simplistic type of thing. I want to
Stretch.
encourage more of like, how far can we go?
Yeah. How far can you stretch it out?
How far can we go? And the curiosity and being able to remember moments in time in my life where, and you asked me what brought me to massage therapy.
Yes.
And this whole life, it's all been stewing together in a soup of direction that I say, once I find that moment in my head, and I'm like, why do I remember that from when I was 3?
Yeah.
When I saw something in Cirque du Soleil on TV. Why did that stick out the most to me? Why did it scare me? Okay, well let's look into that. And then let's try it. And then we're like, oh my God, I'm living it. Yeah. And then we start to live this life that is like, wow, it's all part of the game. Yeah. But this space here just so happens to be the place where I'm able to share all portions of what I'm experiencing with someone and helping them out discover and have curiosity and feel invigorated and feel good to go out and do more.
And talk about that in detail, because I want people to understand what you do, Henry, here as a therapy. And it's not just massage therapy.
No.
Walk me through a client assessment and what do you normally do?
Okay. So some of what I do is also intuitive work. My first thing I have people do is just fill out a regular consent form just to say that it's okay for me to touch you. Yeah. I just get that out of the way.
Welcome to the U.S. Got it.
It's cool for me to touch you. To sign the dotted line. Okay, now we can work.
No.
Depending on what they're dealing with, I will either have them standing, sitting, or laying down. If it's a leg issue or something like that, depending on the severity, I'll assess either balance, eye movement, light sensitivity, things like that.
Why? Why light sensitivity?
Light sensitivity because if they had a concussion, sometimes that might throw off muscles. So we might want to get that balance, especially when I work with my fighters.
Got it. Okay, so more physical training for those trainers. Okay.
I do work with a UFC fighter and other MMA organizations as well. Fighters that fight for different organizations. So when they come in to see me, that's the first thing I check. I want to make sure that those are...
Nothing neurological going on that you can't control, that they have to make sure they're getting checked out.
Right.
Got it.
Right.
Okay.
And then I always look at their facial expression and their light and their eye focus and their smile. And I listen to their laugh. I listen, is it genuine? You can always tell if it's real or not.
Yeah.
And then, because I want to be a real person with someone, I don't want to be fake. It's hard for me to be fake. I don't like that.
You want to find out where they are on that spectrum.
Right.
Okay, if they're closed, in my sense, closed off, how do I get them to open up so they can trust me
of course.
to do the work I want to do?
Right. So what I do, depending on if they're very, very analytical or they're more emotionally connected. If they're, and some people they're worried about their time being spent well, especially their money. You know, if I go somewhere I'm gonna spend my money, I wanna have confidence in the person that I'm spending money on.
I'm getting my worth, my
exactly.
value out of it.
Exactly. First thing I do is I work toward getting range of motion on somewhere on the body as fast as I can.
Why?
To impress.
There you go. I was gonna say that, but I don't want to put words in your mouth.
To impress. Make an impression. The impression within the first 10 minutes, not 5, 10 minutes, is crucial.
That quick.
That quick.
Wow.
Crucial.
Okay. 10
minutes from then on, we can start. And sometimes it might not even be an actual body thing. It might just be straight talk.
Okay.
I had a lady come in, a Spanish speaker, had vertigo, and oftentimes vertigo is just stress that eventually snaps. And I tell her, we can't correct this or change this without relaxing everything. But we have to start with awareness. This is what I'm going to take you through. This is the goal. This is why I'm doing it. And if you don't dig it, that's okay. We're still going to try. And if you don't dig it, that's fine. But I really, really want you to be open and try, because it's something that you haven't tried.
You're looking for help. I'm here to help you.
Exactly. And I really care. And I really care. And I look them right in the eyes. I gotta make sure
you're being truthful with them. You're not messing around.
Right. And then so we move on. And then moving on within the session, then it becomes
with the vertigo person, curious. With the vertigo person, how'd that work out? What was her awareness? What she went through?
It helped her relax. It helped her breathe. When I look at breathing patterns,
that's the key.
If you go to the doctor and they say, take a deep breath and check and listen to your heart, they don't care how you breathe.
Sometimes it's not even in their ears, stethoscope. They're just putting down a number.
Right.
It's amazing.
But if I have let's say someone has 155 heartbeat BPMs.
Yeah.
That's very high, and they're 11 years old. And I tell them, okay, well, we got to change that. How can we change that? Okay, well, why are you at 11 having anxiety?
Yeah.
Whatever reason, I don't know. But
Yeah.
the simplest way for me to change that, I'll put a book on their stomach, lay on the floor, and just elevate the breathing, elevate it up, and let it fall down.
Simple.
5 minutes. We come back, recheck, goes down to 55.
Simple. We can change the rhythm.
Change the rhythm.
By focusing on the book,
right,
not on the breathing.
Right. And that I got that from singing.
Yeah.
It's just that, and so little techniques I find.
So you've kind of integrated your singing, your dancing, and massage together, along with your stretching and other techniques you use to be able to relax their body,
right,
so they can feel healthier.
Right, and then I adapt the modalities of that I've learned from people that work with the Yankees or that work with Tyler Robbins or work with Cirque du Soleil, certain body workers that I've taken their classes, and I'm like, okay, those are very useful tools. Yep. Very useful tools, but I need the platform first.
You need to break them down first so they can accept that.
Exactly. Just like if I want to give my daughter food, and if she doesn't want that food, then I can't give it to you. Yeah. I can't. It's like you want to make an adjustment. Yeah. You're like, well, you're too stiff. We just
have to relax.
We can't do it. Yeah. It won't happen.
You can't do your service. You can't get them to lift more or release the breathing, bring the pressure down, or increase or decrease the vertigo if they can't give you a chance to get in there to feel the difference.
Exactly.
To feel what it is to be a normal, relaxed person or state of mind, at least short term. They go, okay, if I'm good here, how do I get here and stay here? Right.
And then it goes deeper. Yeah. It goes deeper with, like I said, the intuitive work. Sensation of being aware. A lot of times, if I feel something that is uncomfortable for me, for no reason, I'm like, okay, well, we need to take a break. I know that you need to have some breaths.
You don't feel relaxed.
Right. There's something that I'm feeling, whatever it is, I need to take a few breaths now. Yeah. And they themselves they're kind of curious. I was like, how did you know I was starting to increase my level of stress? How did you know? It's like, well, because I'm in your bubble. Yeah. I'm in your space. if you go into a room and someone is not happy, or like, your spouse or whatever isn't happy, the energy's off.
They're like, this isn't my normal person I'm used to.
Right, exactly. And that's so important to be spoken about, and as a practitioner, the maturity that you have to, the work you have to do personally to be able to get to that level, to where you can work with people. Because if you in your own personal practice is not of an integrity level, it's not gonna vibe. You're not gonna be able to do it.
And you have to be able to get out of your own head as a practitioner too, and go, okay, what's this person going through?
Mm-hmm.
What are they really going through versus what they're telling me, and how are they reacting when they talk about it?
Yeah.
Is there an emotional state behind there where I know it's genuine, or are they just talking about it?
Right. Right.
And is there breathing? Or they're looking how's their tone of voice? How's their volume of their voice? Where's their legs? Where's their hands? What's their body going through right now?
When I saw the video, not the whole thing, on the person of tapping.
Okay.
She was a lady, I think it was Glendora. She worked with those kids.
Yes.
And I was like, that's cool. That kind of stuff.
Was it Christy?
I think it was.
Christy Jones.
I think so. I think it was.
I did an interview with her a couple weeks ago. Her name is everywhere. She's famous.
Really?
Crazy. She actually works in a school district.
Oh, that's cool.
It's crazy.
So that portion of emotional connectivity, like the tapping portion.
Yep, that's exactly what it was.
It's very, very similar to that.
Yeah.
But instead of them being aware, sometimes I can catch on to it.
And that's how you get into their space where you can then go, okay, what's really going on? I know you have this problem with your knee, but how's it affecting everything else?
Right, and it's not, and with my work, it's not only, like you said, it's not only massage therapy.
No.
That's the physical portion. It's like dating someone.
Yeah.
Initially, it's what I see.
Yeah.
Then it becomes, oh, what are you telling me? Then it becomes, not even telling me. Now it becomes, what are you energetically feeding?
Yeah. What's your vibe around you
Right, because then they open up. Once they open up, then the energy starts to flow.
Yeah.
And it's flowing, and you can feel it. And it feels genuine, or it feels fake, or it feels like, oh, there's pain there. Okay, and all that can happen very quickly. All that might happen in a few sessions.
It takes experience.
It takes experience. It just
You
takes
can't.
time.
You can't. I deal with a lot of high school kids, even chiropractic students too, and a lot of it is you can't teach that.
No.
That takes time of being shadowing what you do, shadowing what I do too, and realizing the third person, how's everything working out, and having the understanding that I'm moldable right now. If I pick it up the right way, have the right mentors, I can have a faster learning curve.
Oh, for sure.
But it takes that openness to realize what I don't know and how do I get to know that at a faster rate.
And some of that is very uncomfortable.
Of course, it should be.
Very.
You can't get better without being uncomfortable.
And that's why with pain, sometimes the body will hurt. Sometimes if I'm doing a manipulation on this and that, sometimes and I tell them I'm really sorry. I know this sucks right now.
Yeah.
It's not. I'm not gonna push you to a place where you're tapping out, but I'm gonna take you to a place where it's not. You're like,
Yeah.
It feels so great. I know, but then after, okay, thank you.
You're gonna get the result you want.
Exactly.
You can think about this 5 minutes of being there,
right,
instead of where you are right now.
Same thing with investing.
Huge.
I got that money. Okay, I gotta put that money in. Oh man, and then the return.
I won't
yes!
see it in 20 years. Great. If I live that long.
You know that same concept. But the investment in ourselves that then coincides to other things like our whole life.
Well, spending the money maybe out of pocket for health care, with massage, with stretching, with guys, what you do too, Henry, and what I do also, that's quality of life. That's not getting off medication, that's not getting back to work, it's quality of life. And people are willing to spend more money for that now because realize the medications don't get them better. Even sometimes physical therapy only gets them to a certain point, they're told, now you're on your own. Then what do you do?
Right.
What do you do besides working with trainers, say with someone in their, say, 40s and 50s, what's a common problem with some of that age group?
Depending on their job.
Okay, so more occupational based.
Occupational based, habitual based, one gentleman, his wife was a occupational therapist, and he's having some right side pain issues, and the pain was actually coming from when he would use the phone. So, and I asked him, well, do you always use the right hand? And he said, yes. I said, do you ever use the left hand? Yeah. He looked at me like I was a genius.
Like, what? Who's this Albert Einstein guy?
Oh, yeah. Actually, that doesn't hurt. Yeah. So now we can do the stretching and the strengthening. So it's not really about age group. It's I get more of a sense of like how much of a habit and how long of a habit have you had.
What's their daily routine, and how have they gone away from what good is for them and gone to what feels comfortable for them?
Right. Like if I'm playing softball, one side my whole life, or golf or whatever, and that's where I bring in the traditional martial art, which is Taekwondo for me, which is everything was even side. Yeah. Left, right, this balance. Now am I driving with one arm? Do I drive with this arm?
Exactly.
If we study race car drivers, they're like 3 and 9.
Because they realize it can be there for 500 laps.
Right.
Who the heck does 500 laps?
But we don't ergonomically, and ergonomicists, people that teach ergonomics, they don't even know these things because their background is in sociology. Their background is not even in kinesiology. It's not even biomechanics. I don't understand why those fields even exist if their background isn't even in working with movement.
Because they're school-based and business-based. Right. It's not bringing a physical therapist or a trained massage therapist and going, even somebody who teaches Taekwondo, okay, how does the body normally work? How do we get this person realize what normal should be and work around it so they can avoid those problems? It's not the desk, it's the person.
What's funny is if I had a call service business, I'd have 0 desks. All I'd have is a cell phone, a little tablet, and they walk around. Yeah. And because if you're on the phone, you ever notice how you pace?
Yeah. You move your body, move your body.
It engages you. Yeah. If I want to say something, say it. I'm gonna use my whole body. And how much better sales would you have?
Oh, phenomenal!
If you had just
you hear the emotion on the phone. You don't see the emotion on the phone. That's when you actually feel I've done something today.
And when I speak with someone who wants to sell me something, and they might offer me a high price value item, but I know that value is really high. At first the price is like, ugh! Yeah. But then the way it's presented. The way it's given to me, I'm like, man, that's you sold me, and I believe you. I believe you. Yeah. And of course, the risk is everything is risk, of course.
Always.
But and that's in a movement too. If I do this movement, I risk something. Yeah. If I get out of my chair and leave this room and get in my car to go do something, the entire time I'm in a state of risk. So the ideology of safety it's a lie. Safety's a lie. Just give it up. Forget about it. Fear is baloney. And relax and live because it's going to end anyways.
Only a short time.
Yeah.
And when you stay healthy enough, you live not in a wheelchair, not in a nursing home at 60 years old watching bad daytime TV, waiting for bed pattern to be changed up. You live to your fullest. Right. And that's, I think, the key is what we try to do as health practitioners is give someone that better quality life so they actually enjoy that life all the way through. If they're 40, 50, 60, 70, 80, or 90, I think they're 90. And they have the best attitude because they're like, life is simple. But it took them 90 years to get there. Right. To realize, I don't have to make life this complicated.
But what's beautiful about being able to connect with people that are 90 is that we get in contact with that sooner.
How do we learn from that? Not reinvent the wheel.
Our elders are so crucial for us. Yeah. But how many of us are giving attention to people that are not our elders? Yeah. We're giving attention to people that are our age, younger, around that have more things, but not the people that have lived and really find one of my greatest teachers, one of my oldest clients, she's 95, and I've learned almost the most from just being around her, speaking with her, and then you go and help the elderly at their communities, and you just find, or just, I'm Hispanic, so my grandmother is very much a part of my life, and speaking with her and getting knowledge from her is like, wow, that's if we just do that, because our communities used to be the tribe, and in the tribe we used to have the elders.
You teach the youngsters. You teach. It goes back and forth. That's how we've evolved. We've gone away from that.
Right.
And I have no problem learning from someone, mentoring someone who's younger than me, if they know more, are more confident at something I don't know.
Right.
Give me a reason to help you. But when someone is older or younger is arrogant, look, I know everything and I think, oh, good for you.
Right.
You as I learn more, there's more stuff I learn that I don't know.
That's why
How do I learn that?
That's why I love Yoda.
Star Wars never ends. They'll
ends.
always have a different movie every couple years.
It never ends.
There'll always be another saga, another trilogy.
Exactly.
Amazing. Anything else to add, Henry? You've talked a lot about the philosophy and the psychology of when getting in with someone, which a lot of people don't talk about, and sometimes I don't even ask a question. I like that, because that gives people a reason to understand why I should try something different, adapt and realize something that might hurt, and will it improve me down the line? And gaining that trust by understanding the assessment is so huge, just spend that half an hour for it. How long is your assessment usually?
My assessment is about, it goes back and forth. So I'll assess, I'll start working, I'll reassess, start working again.
So your assessment is continuous through the treatment.
Right.
But the initial assessment will give people an idea of, okay, are we compatible? Is this something I want to understand more of, going away from traditional medicine, traditional allopathic medicine, to where, okay, I'm giving this, I pay my copay, I pay my deductible, I have 4 visits, I have to use those, I'm gonna wait for an hour in the waiting room and get more medications, and that's it. Why did she come to you instead? I want to hear your spiel, because I think it's worth it, but how would you word that someone that's going, okay, I'm desperate because I'm tired of being pushed around with medications or not getting help over here, how do I come to you to get that help?
I tell them, we only know if we try.
That's it. It's so simple.
People tell me all the time, well, I don't know. I was like, okay. I don't
have magical abilities to make you want to do what I do. It's up to you to want to give it a try,
right,
and see if it works for you.
Right. I had a gentleman one time on the phone with me, and he was, I spent this money on this physical therapist, on this doctor,
I'm
doctor.
So sorry.
I've had on these surgeons, and I'm like, okay. And I said, okay, I understand your reluctance. I can schedule you in, or I cannot.
Yeah.
Someone else will come around. There's always another bus.
Yeah.
You know?
You don't want to waste time with somebody, and not that patients can be bad, they're humans.
Right.
They've been burned, they have a wall up, they go, hey, look, I'm not ready yet, great, I'll be here tomorrow, and next week when you're ready. I had someone come in, Janice, she was on medication for 10 years. She's had back surgery, so she thought she'd never get chiropractic care.
Right.
Pain management for 10 years.
Oh.
Came in desperate for help. Figured out her back surgery was more of shaving off the disc where it was still manipulatable. Within 10 weeks, she was off medications, went through hell to get the withdrawals, and now she's back to normal life. After 10 years being told she couldn't do anything else.
And I've actually had a couple of clients that have thrown your name out.
Really? In a good way, hopefully.
Oh, yeah.
Okay,
every single person that's mentioned you has had nothing but great things to say about you, man.
Because I push them. I go, look, it's up to you. Give me a shot. Let me help you. Give a couple. And I always go, if we're going to do a treatment plan with you, give you an idea of how we can fix this thing, give us 2-3 weeks and see if you feel a difference.
Right.
Can you figure out, is my body changing? And sometimes it can get worse, sometimes better. But realize your body has to change to get out of the state you're in now to get somewhere else.
I just spoke with a gentleman who said the same thing. He said that when he does his treatment, some of these clients will have a regression, or more not regression, but an actual recycling of the initial sense when they first got injured.
Yes.
And then they'll get better.
Exactly. You have to get through that phase to break up the scar tissue and realize that's part of my treatment. And when you tell them that, no one's ever told that before. They've been told, and usually by the medical doctor, the therapist, hey, look, this should never hurt. You can't get through that point of breaking the scar tissue, all the glue, to cause more motion.
It's like healing.
Cause the body.
Same thing with healing. If you had any kind of deep breakup,
Yeah.
It's going to suck a little bit.
Yeah.
Depending. And then you'll feel better. And you'll feel stronger actually. And then you have more knowledge, you have experience and confidence in your body's ability to heal. All those things are positive.
You have to get through that though and realize that's part of the healing is enjoying the suck to make sure your body gets through that so you get stronger physically, mentally, emotionally, and stay there.
And to cap off too, there's constantly new or different things coming out or discoveries that are not popularly known, and it's up to people that are curious like you and I to continue to seek them out.
And that's why I'm here, to make sure I understand who in my local area, whoever's watching the podcast too, who in your local area has the expertise, the experience, and the wisdom to have you try that, see if it works for you. That's it. Anything else, Henry, for the first video?
No, sir. That's
first video podcast. That's a lot of information, man. I'm drained. I mean, a nap.
That was fun. Yeah, man. The energy.
Thank you for another episode of Quick Spine Show. Thank you guys for watching, and we'll see you next one. Okay?
Cool.
Because that's all it is, man.
Awesome.
It's telling your story of what you think is important people to hear, and that's